Okay, so let me tell you a little bit about me and my journey to being a brain warrior. I am in the middle of 7 children. Growing up, my dad called me a maverick, and to him, that was not a good thing. But I always find myself pushing against the stupidity in the world. In 1972, thank you. So some of you may be as old as I remember the draft. Well, it was a lottery, basically. And my birthday is July 19th, and my number was 19, which meant see you later. And so I went into the military and was trained as an infantry medic. And that's where I became a warrior, but a servant warrior. But about a year into the whole infantry medic thing, I realized I didn't like sleeping in the mud, and I really didn't like being shot at. Some people like that, and we're grateful for them, not for me. And so I got myself retrained as an X-ray technician, and that's where I developed a passion for medical imaging. As our professors used to say, how do you know unless you look? And so I fell in love with medicine, with imaging, and got out of the military on the GI Bill, went to college, and then I got into medical school at Oral Roberts University. And when I was at ORU, as a second-year medical student, someone I cared deeply about tried to kill herself. And I took her to see a wonderful psychiatrist, and I came to realize that if he helped her, which he did, it would not only help her, but it would ultimately help her children and even her future grandchildren, as they would be shaped by someone who is happier and more stable. I fell in love with psychiatry because I realized it has the potential to change generations of people. And I have loved it every single day since. And you better believe I'm a brain warrior for the health of my patients' brains, because, I take care of really sick people. We've scanned 90 murderers, I've testified in death penalty trials, suicidal people have been abused. It's a war. But I have to get them to be warriors with me. Otherwise, they'll keep hurting themselves and they won't get well. So I said that. 1991, so this is a real pivotal year for me. I started the first Amen clinic in Northern California. And I went to a lecture on brain SPECT imaging. SPECT is a nuclear medicine study that looks at blood flow and activity. So it's sort of odd for me, who loved imaging. I picked a medical specialty that in fact is the only medical specialty that virtually never looked at the organ they treat. Think about that. Cardiologists look, your neurologists look, your gastroenterologists look, every other medical specialty looks. Most psychiatrists guess. They make diagnoses like they did in 1840 when Lincoln was depressed. They talk to you, look for symptom clusters, and then they diagnose you and treat you. And I thought, well, that's sort of dumb. We should be looking. And so I went to this lecture. I got really excited because imaging plus psychiatry, it's what created a revolution in my life. So over the next 24 years, my colleagues in Amen clinics have now built the world's largest database of brain scans related to behavior. So we've done 115,000 scans on patients from 111 countries. And people around the world, they have depression, they have bipolar disorder, they have ADD, schizophrenia, addiction, and so on. Now, the images just taught me so much. So here are 2 SPECT scans. Healthy one on the left. So SPECT tells us 3 things. Good activity, too little, or too much. So the image on the left, all you're looking at is this shape, and it's looking at blood flow. And and we want it to be full, even, and symmetrical. The image on the right is showing us the really active areas in the brain, which are typically in the back, in an area called the cerebellum. So here's what 2 strokes look like. So you can see the difference, right? This isn't hard. So a stroke is where a blood vessel either breaks or clot goes and closes it off, and brain tissue dies. So obviously it's going to then have less blood flow. Alzheimer's disease, where the back half of the brain is deteriorating, traumatic brain injury. And one of the big early lessons I learned was that mild traumatic brain injury ruins people's lives, and nobody knows because they go to see psychiatrists that never look at their brain. And so the NFL actually formed its concussion committee in 1994, but they never sponsored a brain imaging study. So you have to ask yourself if they really wanted to know the answer to the question, which we'll talk about in a little bit. Drug addict brains just looked awful. The real reason not to use drugs, this includes marijuana. I hate to burst your bubble that you think it's good medicine. Seriously? Oh no, this is good for me. It lowers my reaction time, it demotivates me. I can't remember anything, but it's good for me. All right, so when I first started scanning people, I was the director of a psychiatric hospital unit that took care of drug addicts. And so I had all sorts of these scans, and they were so awful. I brought them home to my 4 children and effectively induced anxiety disorders in all 4 of them when it came to drug abuse. So this is what we see with OCD, obsessive compulsive disorder. See, the front part of the brain works so hard, you can't stop thinking. Or this is somebody who has post-traumatic stress disorder. Their emotional brain works way too hard. Okay. So as I started doing imaging, I got really excited. And I thought of it this way. A picture is worth 1,000 words, but a map is worth 1,000 pictures. A map tells you where you are and gives you direction on how to get to where you want to go. And so we're doing these very cool maps. And what I got excited about is they changed people's lives. And the first person's life they changed was mine. So I got so excited about the technology, I just scanned everybody I knew. I scanned my mom, and it was so irritating because she had the most beautiful brain. So she was 60, and I'd done enough scans. It was the prettiest brain I'd ever seen. And I looked at her. I said, "Come here." I said, "You've ruined my life." And my mom's a very connected person. She got this little pouty face, and she says, "What are you talking about?" I'm like, "You have a super normal brain? I thought all women would be like you. But you don't have a normal brain. So you ruined my life." And then I scanned myself, and that was my original scan, and it looked awful. It's like bumpy, and it's not healthy, and I'm actually someone who's never done drugs. I just thought that was really stupid. I mean, I like to be in some control of my life. And I don't smoke. But when if you really know what I know now, I had bad brain habits. I didn't sleep more than 4 hours a night because I was busy, was chronically stressed, I overate. Diet soda was like my best friend. And it was just, when I saw my brain, I was horrified. That's where I developed the term brain envy, because I wanted mine to be like my mom's. And so through all the things I'm going to teach you, 20 years later, my brain looks healthier, bigger, fatter. And that's not what usually happens. Usually with age, our brain gets less and less and less active. I'll show you in a minute. The scans actually changed everything in my children's lives because, quite honestly, if you dated one of my kids for more than 4 months, I scammed you. Do you ever see Meet the Parents? This is worse. In fact, just this week, my son has a new girlfriend, like 5 months, and I'm like, you need to bring her by the clinic. I mean, I really like her. I think she's really great. And she had a great brain, thank God. Imaging changed everything in my own love life. I was married for 20 years, and it wasn't good. And so, 15 years ago, I got divorced. And, someone who grew up Catholic, that's a big deal, like a really big deal. And I'm like, if I ever fall in love again, I'm going to see their brain before any other intimate part. And so I met Tana, and she's a neurosurgical ICU nurse, and she loved my work. And I'm like, this is 2 weeks into our relationship. I'm like, what are you doing this afternoon? I said, you haven't been to the clinic. You want to see the clinic? So that's her in the camera. That was her brain. So I married her. So this is what happens to your brain over time. When I turned 60, it was a little weird, right? Because this is normal. And what I want to tell you is I don't want normal for you, because normal is sick. I am not interested in normal, and I can't imagine anyone associated with Jeff's company wants to be normal. You all want to be optimal. So this is typical, a typical 55-year-old brain. You see the wrinkles and holes, sort of like on your face, you have wrinkles and holes. And this is a typical 82-year-old brain. I mean, this looks awful. This is Doris Rapp, who's 82. You do not have to give in to aging. The health of your brain is much more about your habits and the nutrients you consume than your age. And now that I'm 61, I know I'm in a war. I know it. I see what gravity does to your face, and I've seen what it's done to tens of thousands of brains, and I don't want it, and I have a choice. You have a choice if you're smart. As a psychiatrist, the other really cool thing SPECT imaging did for me is it decreased stigma for my patients. They saw their problems now as medical and not moral, so there was less shame and guilt. And what I really loved is it increased forgiveness and compassion from their families. We had nothing else in psychiatry to do that. And the coolest thing, it completely changed the discussion around mental health for me. Quite frankly, no one wants to see a psychiatrist. So it's 1980, I tell my dad I'm going to be a psychiatrist. He gets mad at me. He said, why do you want to do that? You want to be a nut doctor? That's seriously what he said. Why do you want to do that? And quite frankly, no one wants to be labeled as abnormal, as defective, as crazy, but everybody wants a better brain. So what if mental health was really brain health? And that's my experience. If you get your brain right, you feel right, you act better, life is better. Okay, so I said all of that to get to this slide. This is the most exciting lesson I've learned from looking at 115,000 scans on people from all over the world, just like Jeff said. I love that, because when Jeff came, his brain wasn't as healthy as it should have been. And now it's better. But now he's a warrior to make it even better still. You are not stuck with the brain you have. You can make it better, and I can prove it. And I love that.